You've probably heard of vitamin D as the sunshine vitamin, but did you know that low levels have been linked to breast, prostate, colon, and even pancreatic cancers? What most people don't realize is vitamin D is not a solo act. Without vitamin K2, that vitamin D might be sending calcium to the wrong places, like your arteries, instead of your bones and immune cells where it's needed most. That's where K2 comes in. It's the director, telling your body where to put the calcium that vitamin D helps absorb. Now, why is this relevant to inflammation and cancer? Because chronic inflammation is a breeding ground for disease, and vitamin D plays a major role in regulating your immune system, keeping inflammation under control, and helping your body fight abnormal cell growth before it becomes dangerous. But if your levels are low, your immune system is flying blind. In fact, studies that people with low vitamin D levels are more likely to develop cancer. I've seen this in my own practice. One of the most common denominators in my breast cancer patients is a low vitamin D level, struggle with autoimmune conditions, and have higher markers of systemic inflammation. That's why in my practice, I always test, never guess. We check 25 hydroxy vitamin D levels and make sure they're not just normal by lab standards, but optimal for healing and protection. We also look at inflammatory markers like CRP and homocysteine, and sometimes we check arterial calcification in patients with cardiovascular risk. Now, let's talk about dosing because more isn't always better. I typically recommend a vitamin D3 paired with K2, ideally in a vegan soft gel or spray, and the dose depends on your labs, sun exposure, and your unique health profile. And remember, vitamin D is fuel, vitamin K2 is GPS. Without both, your body cannot drive healing where it's needed most.